we already had a presentation about the importance of lactate. It was very interesting, and I would like to share with you a little bit different view on lactate continuum monitoring and the value of the continuum of care in lactate, starting from the outside of a hospital, pre-hospital environment, going to critical care, and then go to intrapartum management. This is the agenda for today, for this particular talk. Brief introduction. We already had introduction, so I'll go quickly. Pre-hospital lactate, hospital emergency, and then intrapartum. I think it's easy. I'm going to translate it. So I used to work in a laboratory for many years, so I have a little bit different look on common problems. Lactate used to be a very popular marker many years ago. Then its popularity went down, and there was a lot of criticisms about being generic, and it's not being really reliable in the measurements. And now it's quite popular again. It's in the guidelines, it's in the SOFA scores, and we already heard about it this year. So I'll try to give you a few ideas why there was a problem with measuring lactate before and why it is popular now again. I think we can go. Okay, so this is a lactate. I will not talk about the basics because we already know about it. Now, there's one important thing. I mean, there are two optical isomers of lactate, L and D lactate, okay? And from someone who works in R&D and someone who develops the biosensor to measure lactate, this is a little bit challenging, okay? So at the beginning, the early lactate biosensors were not distinguishing very well between L and D isomers of lactate. So hence, in many systems, you will have an elevated or incorrect lactate, okay? So that was one of the reasons. It got corrected, but it was one of the reasons. There is another problem in measuring lactate. Lactate has no recognized gold standard, has no recognized reference, okay? As you know, if you develop a new assay, you have to have a reference measurements to compare your measurements and be sure you're measuring correctly. There are gold standards for measurements from ISDM, and lactate does not have this recognized standard. So people are developing it, comparing it to a central lab analyzer, mass specs, but there is no standardization, hence there are differences in the measurements.
Deci, ca idee, până acum 15 ani în urmă, lactatul era un marker utilizat destul de mult, însă apoi a început să scadă. Una din motivele de ce acesta a scăzut, pentru că noi aveam două forme de lactat, varianta L și varianta D, și din păcate pentru echipamentul, deci aceștia sunt izomeri, deci vizualul arată la fel pentru aparatul care îi măsoară, și abia acum, deja în studiile recente, s-a reușit ca aparatele să măsoare corect, pentru că înainte, pur și simplu, se obțineau valori mai mari decât erau în rezultatul măsurărilor probelor de sânge. Și una din altele probleme este că noi nu avem un standard de aur, adică pentru echipamentele medicale, care să știm cum de măsura corect nivelul de lactat.
Okay, so I will not spend a lot of time here. We already know this. The important thing to remember is that we have two processes. One is the production of lactate, the other one is the clearance of lactate, and I'll talk a little bit about the lactase clearance or lactate shift later on, but this is, we already heard about this. Now, I said we'll go from pre-hospital to intrapartum, just to sort of try to cover in a few minutes the continuum of care and the continuum of advantage of measuring lactate. So in the pre-hospital, we look on ambulances, we look on helicopter care, and we look on everything up to a patient triage where lactate can be correlated to treatment and mortality. I think we already talked about lactate, so you all know everything. So this is, again, I just took a few summary quotes from different publications. Lactate is an early indicator of a patient distress, and the patient is directed to the right specialized center in the region. If you do it in the ambulance or any out-hospital services, you can optimize time. Of course, faster diagnosis is better. You can optimize cost, and you can optimize patient safety. This is a schematic of flow of patients using the example of a sepsis. In the hospital, in the emergency ward, we have diagnostic and transfer after a triage to specific department. In the hospital, we have monitoring, but we can start an early assessment and triage even outside of the hospital to gain time, especially for septic patients. And we can use a lot of different tools to do it, not only lactate, but also looking on kidney functions, looking on critical care analyzer, and so on and so forth. I think it's self-explanatory. This is Surviving Sepsis campaign. We already saw this guideline. Now, I would just like to point your attention to the very first part of it, where the author is saying that the lactate level must be available in your institution with a rapid turnaround time within minutes. Now, they don't specify per se that it has to be point of care, but of course it cannot be done in this case for sepsis in a central lab because there is no physical possibility to get these results within minutes. So it has to be point of care or a critical care analyzer that you have close to you.
Deci, ca idee, nivelul de lactat nu este doar un parametru și trebuie monitorizat în zona de terapie intensivă, el își are loc cât și fie în ambulanță, fie în transferul, de exemplu, cu elicopter al pacientului. Deja noi tot știm cât este de important ca predictor, de asemenea putem să utilizăm și alți predictori pentru a înțelege, de exemplu, când merge vorba de pacienții septici, cum ați văzut în slide-urile anterioare. Și deja chiar și Surviving Sepsis Campaign, ghidul nostru care stă la bază pentru pacienții noștri septici, spune că prezența unui aparat de echilibru care îți permite măsurarea nivelului de lactat trebuie să fie un standard de tratament și datorită acestea noi puteam să scurtăm semnificativ perioada de timp de la pacientul nostru când intră pe holurile spitale până deja ce își încep tratamentul.
Okay, and here is a paper from our collaborators in France. The objective, this was a big study, LAPSU study for patients with septic shock. The objective was to provide a clinical evidence that the pre-hospital blood lactate level predicts a 30-day mortality in patients with septic shock. That's a big study, a total of 1,000 patients that were included in this study in so-called mobile ICU. These are specialized ambulances. Sorry. And here is what the authors found during the study. Majority of the sepsis cases occur in the pre-hospital environment, so it's important to detect them as soon as possible. And the increased blood lactate level is a better prognostic indicator than other dysfunctions, and the blood lactate is the only biomarker of tissue perfusion validated in the extra-hospital setting, because this is also important. I think that's easy. This is the early detection of patients with sepsis, and you can see that there is a clear correlation with a pre-hospital lactemia of over 4 millimoles per liter that correlates in a negative way with the survival rate of those patients. In the conclusion, the authors say that this study provides a clinical evidence that the pre-hospital blood lactate level predicts the 30-day mortality of patients with septic shock. And the results of the study provide conclusion also that the utility of the pre-hospital blood lactate level for the triage and early orientation of patients with septic shock.
Deci, ca idee care se vrea conturată, deci, în primul rând, nivelul de lactat este singura variantă care ne arată nivelul de perfuzie tisulară care este validată pentru pacienții în afara condițiilor de spital și de asta și are importanță de măsurare și studiul care l-ați văzut anterior, care a făcut pe mașini de terapie intensivă mobilă, asta a demonstrat că poate fi utilizat și ca factor de mortalitate și de asemenea ca un moment care trebuie de pus ca idee este că utilizarea acestor marcări, deci ca pre-spital, de asemenea trebuie continuată și după.
And simplifying the point of care will allow you to reduce the turnaround time, reduce sample volume, that's of course, and improve a few key performance indicator for the patients, time to triage and time to antibiotics. Of course, the sooner you can diagnose the patients, the better, I it's easy. We've encountered a potentially septic patient outside of a hospital in the ambulance. We applied the diagnostic tools to confirm or not that this patient is septic. We measure the lactate. Now we move the patients to a hospital. Very briefly, I will not talk about this. We already talked. Sepsis is unfortunately still a very big problem worldwide. This is a reasonably recent study. It talks about over 50 million cases and 11 million deaths. Unfortunately, sepsis is still a big burden. Here is a graph showing the importance and the gravity of sepsis. As you can see, the highest, this is a global death, the highest mortality we will have, obviously, here in the neonates, late neonates and post-neonatals because of the gravity of the sepsis in this group, and then also in the elderly patients, because these are all the most fragile patients, both small childs and elderly patients. I think it's easy. Okay. So sepsis is there are many new approaches to sepsis, new definitions, but it's still an old issue, and still it's very difficult to fight, and so we still have a lot of people dying out of sepsis. But I think there is a consensus that the early diagnostic and early treatment is the key. And an early diagnostic will allow you correct triage to address the patients to a proper hospital structure, proper and fast therapy, and it will allow efficient patients monitoring during the treatment, because we already heard today about monitoring the lactate during the treatment and looking on lactate clearance. Okay, and this is a little bit the idea of using point-of-care applications for lactate measuring in this group of patients, because it's a so-called sepsis care continuum. We try to diagnose the patients as soon as possible, even before they get transported to hospital, to gain time, and then treat them in the hospital as soon as possible.
Deci, la urmă măturați că 70% din pacienți devin septici în condiții de în afara spitalului, deci este destul de important să înțelegem nivelul de lactat cât în pre-hospital. De asemenea, acum am trecut la nivelul de măsurare lactatului, deci intraspitalicesc, care de asemenea ne arată ca factor de predicție și trebuie să avem grijă în special de pacienții. Sepsul este periculos pentru pacienții care sunt neonatali sau pacienții vârstnici, deci aceștia sunt pacienții cei mai sensibili și chiar și dacă noi avem o definiție nouă a sepsului, oricum noi avem aceleași vechi probleme, deci legate de pacienții septici, și de asta noi utilizarea și calcularea nivelului de lactat ne permite să efectuăm un triaj corect, să facem o terapie corectă și să scurtăm durata de la internare până pacientul își primește tratament specializat în spital.
And going back to the surviving sepsis consensus document, as I said before, lactate is now an important biomarker, and this not only it has a quick turnaround time, you have to be able to measure it fast, but actually in this consensus document the author is saying that the lactate measurement must be available in your hospital to get the response as soon as possible. Now, this is so-called our one bundle for sepsis that is included in the guidelines. So now it starts with measuring lactate level. Of course, then you do cultures, you look for the cause of the sepsis, administer broad-spectrum antibiotics, and so on and so forth. But then also the authors are saying that not only you should be measuring lactate once, but then you should re-measure if initial lactate is elevated above 2 millimoles per liter, and then during the treatment there are indications, and we'll look on it, to actually look on lactate clearance and monitor the lactate content.
Deci, ca idee care se dorește de a fi spusă, deci avem ghid de sepsis surviving campaign, deci noi trebuie să avem nivelul de lactat ca să poată fi măsurat la interval de câteva minute după ce proba a fost preluată, și avem aceste bandelete sau aceste ghiduri pentru pacienții septici care în prima oră ce trebuie să facem și dacă observăm la punctul 1 și deci noi trebuie să măsurăm nivelul de lactat și dacă pacientul vine cu un lactat mai mare de 2, atunci acesta trebuie reevaluat.
And here, importantly, in the same document, you will find that, of course, you have to start resuscitation early with the source control, fluids and antibiotics, but it actually makes a nice link, and this is a copy-paste from the Surviving Sepsis campaign. And the authors are saying that the frequent assessment of the patient's volume status is crucial throughout the resuscitation period. So hence the idea that I told you before about trying to measure or estimate the volume status of the patients, because it is also important, and also in a way of how you design the critical care analyzer, not just the blood gas. So it will give you the most complex answer to treat your patients. And also the authors suggest guiding resuscitation to normalize lactate and to monitor lactate level and look for lactate clearance.
Deci, ca mesaje cheie care se doresc, deci, în primul rând, încă o dată este vorba despre disponibilitatea măsurării nivelului de lactat, de asemenea, să fim destul de atenți la statutul volemic al pacienților, pentru că, raportând la prezentările anterioare despre nivelul plasmatic de sânge, să luăm deciziile corecte, cum să ne ducem terapia volemică la acești pacienți și, de asemenea, ca un ghid de tratament pentru acești pacienți, este să tindem spre normalizarea nivelului de lactat, care ne arată este un marker pentru hipoperfuzie tisulară.
Okay, so now we know that lactate is important and we have to measure it. So now how we can measure lactate? Okay, so in there are multiple ways. Of course, you can send sample to central lab. You can measure lactate in a blood gas analyzer, and you can also measure lactate in smaller point-of-care devices. Okay. Because I used to work a lot of time in the lab, and I now work in the hospitals with many of your colleagues. In the measuring lactate, there are many pre-analytical issues, and some of them are directly linked to the problems of lactate measurements and the fact that a few decades ago or 10 years ago, there was a general a problem with lactate measurements, and the popularity of lactate as a biomarker went down. So you have to be aware that if you take a sample, if you take a venous sample of blood, you should be measuring this sample for all parameters, but we're talking about lactate right now, as soon as possible, okay, within a minute. Because blood sample is a living tissue. So once you take it out, you will have several processes going in the same time. So your tissue will consume continuously glucose. So if you measure it over time, your glucose level will go down because it's continuously metabolized. Your gases will be incorrect because the tissue is living and it's breathing, so to speak. And it's also, you will see the increase in lactate over time, okay, as a resource of metabolites. So you have to be aware of it, and you have to measure it correctly. If you look for point-of-care lactate and you will measure capillary blood sample, you have to remember about the pre-analytics because, for example, the sweat on the skin contains very high concentration of lactate. It's actually concentrated because it's dry normally. So if you don't clean your finger correctly and you take the capillary puncture and you measure lactate, your value can be really, really high. And when I say high, it can be above 10. Okay, so the patients might be normal, but it's just a contamination issue. So all those problems make lactate measurements not easy. It's a very good biomarker, but you have to be aware of the problems or caveats of measuring lactate.
Deci, acum deja nu trebuie să trecem de la măsurarea și importanța la măsurarea propriu-zisă a nivelului de lactat. Deci asta trebuie să fie făcută cât mai repede posibil. Scenariul perfect ar fi în jurul la 1 minut, pentru că până la urmă sângele care se prelevează, dacă vorbim de probele venoase de echilibru, este un țesut viu și atâta timp cât el stă cu atât mai mult în afara corpului, cu atât la noi o să avem și valori o să avem valori incorecte, o să ne cadă valorile de oxigen, adică care le aveam pe echilibru, o să ne crească lactatul, o să ne scadă glicemia Și de asemenea, dacă se dorește o măsurare la nivelul capilar al lactatei, să fim foarte lactatului, să fim foarte atenți, să facem o decontaminare și cât și a mâinilor persoanelor care recoltează această probă, cât și a persoanelor de la care această probă se prelevează, pentru că valorile deci un deget care nu este prelucrat poate să ne dea rezultate fals pozitive și să obținem valori de lactat chiar și de 10. Ceea ce pe noi poate să ne ducă în eroare și să fie ca rezultat doar din cauza unei prelucrări precare a degetelor pacienților noștri.
And as I, oops, again.
It's okay.
Okay, I'm sorry. And again, as I said, if you leave your blood samples in the room temperature, the lactate can increase up to 50%. And here is a study that shows you the blood sample was kept on wet ice pack and room temperature, and you can see that there is a very significant increase of lactate over time. In a half an hour, it can go up to even 50%, depends on the storage conditions and the temperature, I think.
No, we don't know about it. Deci, o idee care se dorește conturată e că lăsarea probilor la temperatura camerei, deci poate să ne ducă la valori de exemplu la 20 de grade, poate să ne crească cifrele de lactat cu până la 50%. Și dacă ne observăm că dacă se ține la 0%, deci avem cu totul alte valori.
Okay, so this is just to make you aware that if you have it, I mean, of course you know, but if you have we talk about critical care patients, this is why we have the blood gas analyzer or the critical care analyzer located in ICU. You just have to measure the parameters as soon as possible within a minute. This is a study published about lactate in hospital mortality. Lactate measurements in the sepsis-induced tissue hyperperfusions, and this is a big study included in the Surviving Sepsis campaign database. That's more than 28,000 observations, and there is significant mortality when lactate is above 2 millimole per liter in the presence of hypotensions, and the mortality is increased almost twofold from 29 to 44.5%. As you can see on the graph, this is the solid black line with the arrow indicated. I think that's easy. Okay, and we talk about, we already heard today about lactate clearance. It's either lactate clearance or lactate shift. This just shows you that not only you can use lactate as a biomarker for diagnostic, but also during the treatment, and it's one of your indicator if the treatment is progressing correctly, because you will see the lactate going down. Now, this is one of the studies about lactate clearance for death prediction in a severe sepsis or septic shock within the first 24 hours in the intensive care units, 94 patients. We already saw the formula, how they measure it before, and there is a clear correlation between lactate clearance and the 28-day mortality, as shown here, in the patients that were able to respond to the therapy, and the lactate level went down within the 24 hours. The survival rate is significantly higher than in the non-survivors that did not respond well to the treatment.
Okay,
I think it's okay. This is another interesting study, quite big also in terms of patients' retrospective observational study. This is emergency department bedside point of care lactate in patients with suspected sepsis is associated with reduced time to IV fluids and mortality. Here the authors were looking on multiple parameters. The study groups were similar in age, gender, SOFA scores, sepsis severity, and so on and so forth. And the idea was to introduce the point of care lactate measurements to gain time to make the lactate measurements as soon as possible. And the authors concluded that when they did this during the study, there was significant reduction in test turnaround time. That is the time since you start the test and you got the result and you can make a treatment or make a clinical decision. This is very striking because when you look, okay, this is a particular hospital. In your hospital, it might be different. But here we have a difference between normal time was practically 2 hours down to 30 minutes. Okay, so this is very significant time saving. There's a reduction in time to IV fluids, also significant but not as striking. And there is a very significant reduction in mortality. When you look on the reduction in mortality, it goes from 19% to 6%. That's threefold because you're gaining time. And when you gain time, when you gain more than an hour, 1.5 hours in this case, you can start treatment early and you have higher chance to get the patients out of this mortal danger. And there's also a reduction in the ICU submissions, significant reduction.
Deci, ca momente că noi avem, de fapt, nivelul și clearance-ul lactatului și de asemenea interesează și variația acestuia ca valori. Și din moment ce noi introducem măsurarea nivelului de lactat ca un standard procedural, studiul dat care l-ați văzut dumneavoastră arată că, în primul rând, s-a micșorat considerabil de la 122 la 34 de minute, deci perioada când pacientul se internează și începe să-și ia tratament, a dus și la o micșorare a timpului când pacientul își primește dozele sale de fluide și, cel mai important, a dus și la o micșorare a ratei de mortalitate de la 19 la 6% și a micșorat numărul de pacienți care vor ajunge în secție de terapie intensivă de la 51 la 33%.
And in a summary, of course, sepsis is still a growing burden. Time is very important. The sooner we can get the diagnostic, the better. We're cutting time for triage and treatment. And the point of care, and by point of care I don't mean only the small meters, I also mean the critical care analyzer that you have in the ICU, can provide a solution across the overall pathway of sepsis care, from ambulance, as we talked before, to hospital care continuum, from early assessment outside of the hospital to patients monitoring, and of course not only lactate, because if you use the modern critical care analyzer, you will have a lot of more parameters to guide your treatment, but here the most important one is time for lactate and sepsis. I think it's... Okay. If we use point of care, it was, as I said, reduce time to test results and to intravenous fluid. Is cutting the triage. It reduces rates to ICU admission and mortality. Okay. Now I would like to take a close look on a very specific application for lactate during the intrapartum, and specifically the fetal scalp lactate. I don't know if you're using it. I don't know if you use lactate in fetal scalp lactate in your hospital. It's an interesting topic that we collaborate for a long time. There are many ways of doing the intrapartum monitoring, ultrasonograph, CT, and so on and so forth. I'll not talk about it today. We'll just focus on fetal blood analysis. That's easy.
Walt. O altă variantă de utilizare, deci ar fi utilizarea nivelului de lactat la scalpul fetal. Deci a fost observată întrebarea dacă în țara asta se face, pentru că asta de asemenea poate fi utilizat ca o metodă de monitorizare pentru fet, cum ar fi ultrasonografie, cardiotocogramă sau preluarea analizelor din sângele fetal.
Okay, and why are we measuring fetal scalp lactate and why it is important? Well, simply put, to detect early and avoid asphyxia. Okay, this is a suffocation. It's a mix of clinical conditions of hypoxia, hypercapnia, and acidosis. There are multiple reasons for it, but it's a very dangerous condition, and the consequences, if it happens, are irreversible. Brain and organ damages for the fetus and the child that will be born.
Utilizarea aceasta, deci în nivelul de lactat, la scalpul fetal, în primul rând, să ne ajute să presupunem deci, o hipoxie la fet, o hipercapnie sau o acidoză, care pot fi deja, nu cred că toți știm motivele care pot, de ce o să duc la aceste condiții clinice.
And as I said, the combination of hypoxia, hypernapnia, and acidosis can lead to neonatal asphyxia. and it can lead to irreversible damage to the brain and vital organs. Importantly, it can occur in utero or during delivery. So if you monitor either pH as it used to be or lactate, fetal scalp lactate, the goal is to identify and prevent these complications. Okay? Do you want to?
Deci, ca idee care trebuie să înțelegem că combinația dintre hipoxie, hipercapnie și acidoză este o combinație care a arătat șansele suicid de fetul și o să duc la leziuni reversibile pentru acesta și acesta pot să apară cât și în perioada fără copilului minute, cât și în perioada când se declanșează procesul de naștere, iar scopul nostru de bază nu trebuie să uităm că noi trebuie să identificăm și să prevenim hipoxia și suferința fetală.
Okay, so you probably know in a daily practice that normally in a fetal blood analysis the fetal scalp pH has been measured or still measured. Okay, these are the values you can find in the guidelines or in many publications. Above 7.25 is normal, and you should repeat the measurements later on. Below 7.21, it's a borderline that has to repeat faster within half an hour, and below 7.2 is abnormal. It's widely used, the fetal scalp pH measurements, but it has disadvantage. The disadvantage is really more technically than anything else. So normally in these cases you would measure the pH using the blood gas analyzer or the critical care analyzer you have. Now, because of the how you're extracting the samples and the size of samples, the volume you need, there is a very high sample failure rate. So your sample might not be read correctly, okay? And if it's happened, then you have to repeat it, and that's difficult. Of course, you have to have blood gas analyzer close and everything, but this is the technical issue that is the most important one that makes pH measurements in this setting simply difficult and not really reliable. I mean, if you get the result is reliable, but to get this result is difficult.
Deci, ca idee, dacă se face măsurare, da, se vedem nivelul de lactat și pH. Deci, dacă avem un pH sub 7,25 anual și această analiză trebuie să repetate timp de peste 60 de minute, dacă mai avem și normalități de frecvență cardiacă, deci o deviere a pH-ului de 7,21, 7,24 ne va face să micșorăm, să repetăm peste 30 de minute și să ne gândim la o cezariană pentru acești copii sau la o grăbire a procesului de naștere și un pH deci de sub 7,20 trebuie interpretat ca să punem riscuri pentru mamă și pentru copil în aceste cazuri.
All right, don't worry, we're going slowly to the end. So because of these technical issues, there was a big study done several years ago, or more than several, and it was trying to answer the dilemma whether we can find a different, technically easier but also very reliable method. And this is the Witzberg-Ixel experience paper published in the study, where the authors compared measurements of pH to measurements of fetal scalp lactate. And this is the results of the study. There was a big study, more than 3,000 subjects divided into two groups with a fetal scalp pH or scalp lactate, more or less half and half. And the authors looked for a cutoff for pH and the lactate. Now, the very important thing in this study is that what the authors concluded is there is no significant difference in the clinical results for both methods. So it is as good to measure pH or fetal scalp lactate in terms of precision and in terms of a clinical decision. Now, what is really important is that the authors look on the overall results of the study, and they concluded that if you measure the pH, you simply have significant error rate in the measurements. Okay, so when you look on the total measurements, you have 164 errors, which is 11%, versus only 22, which is 1.5 in the total procedures. Okay, so the authors concluded that the pH testing result in significantly more protocol variations, which are just simply errors in measurements, than lactate determinations. And then they concluded that it is as good to measure lactate as is pH, but measuring lactate is simply technically more viable, it's faster and easier, and you avoid all the errors.
Deci, fel de care acum am vrut să concludem, deci s-a făcut un studiu comparativ dintre măsurarea nivelului de pH și lactat pentru fel și s-a observat că atunci când se face măsurarea pH-ului aveam o șansă foarte mare de interpretări greșite. Deci vedeam că mai 164 de probe care nu au arătat valorile corecte, însă dacă să corelăm ca eficiență, fie că este măsurat pH-ul, fie că este lactatul, deci acestea ambele pot fi folosite ca predictori corecți pentru acești pacienți și astfel utilizarea nivelului de lactat nu o să ne ducă atâtea probe greșite ca măsurarea pH-ului.
And here just important comment that if you detect or if the authors detect any signs of danger to the kid, to the newborn, such as asphyxia, it results automatically in the C-section. And in many cases, because of the errors in measurements, they were not sure if the result is correct, so they just go for a C-section just to be on the safe side. And this was probably in many cases unnecessary if you could just measure fetal scalp lactate and avoid the errors in measurements. The values has been included in the guidelines. This is NICE guidelines where lactate has been added to the old historical pH values, and here is the table. pH normal is, as I said, 725 or above. For lactate normal, for fetal scalp lactate will be 4.1 or below. Borderline lactate will be 4.2 to 4.8, and abnormal, the cutoff is 4.9. Okay, one have to be aware here, and this is work in progress. There are many publications coming, and some already there. Since there is no gold standard in lactate measurements, and you might have been using different lactate measuring methods, even in your hospital, you might have point of care, you might have critical care analyzer, and you might have central lab. Be sure that you establish a cutoff based on one method and you correlate the methods, because they might be different, okay? And normally they are different, okay? So this is important, and many people now switching to FSL, but they do internal studies and they confirm the official cutoff, or they establish their own cutoff if they use different method.
Deci, ca recomandare când merge vorba de măsurarea nivelului de lactat fetal și nivelul scalpului, deci noi trebuie să avem valorile care de fapt noi să ne ghideze, și asta ar fi la nivelul de pH, ar trebui să fie peste 7,25, o schimbare de limite ar fi 7,21, 7,24 și ar trebui să fim îngrijorați de nivelul de sub 7,20. Și la nivelul lactatului, deci noi ar trebui să avem valori mai joase de 4,1 mmol, deci schimbări de la limit ar fi 4,2, intervalul 4,8 și ar trebui să ne îngrijoreze orice valoare mai mare de 4,9 mmol sau mai mult. Și un moment foarte important este care trebuie să înțelegem că trebuie să avem unul și același standard de calitate, pentru că fie că proba este dusă la laboratorul central, fie că ea este făcută ca standard of care, fie că aceasta este, de exemplu, avem un analizator de urgență care se face, deci această procedură trebuie standardizată ca să înțelegem corect pronosticul ulterior pentru pacient.
Okay, whoops, again.
It's okay, don't worry.
Now I know when to turn it on. Just to show you a more recent study that has been just a validation of the method. Now here the authors look on the pH and the lactate, point of care lactate, and also lactate validated in the critical care analyzer. There was a radiometer ABL 800. Importantly, there is a very good correlation between pH and lactate. And again, the authors concluded that there is a significantly lower number of sample errors, 22, almost 23% errors on the blood gas versus 0.5 using point of care lactate method. And the authors also said that the cutoff to be determined individually in your hospital with the method you will be using for the regular standard measurements. Okay. So going to summary, there are many advantages of fetal scalp testing. You get additional information on fetal condition and distress, and it's reliable and easy. Of course, point of care will offer you the advantage of using significantly smaller volume than the blood gas analyzer. There are significantly less testing errors. You got very fast results, no daily QC, and very good correlation with pH. On top of that, the fetal scalp lactate has been included in the new NIST guidelines as a standard method that correlates with pH.
Deci, ca să urmărizăm, care ar fi avantajele din măsurarea a nivelului de lactat al scalpului fetal? Deci, în primul rând, că este un pronostic care ne arată hipoxia la pacienți. Deci, în primul rând, este micșorarea numărilor de erori, avem rezultate destul de repede. Ne arată o bună corelație cu pH, care ați văzut că poate fi de foarte multe ori poate să ne ia erori, și de asemenea ghidurile NIS sau NICE, deci ne recomandă instant ca să fie utilizată această metodă de diagnostic.
And this is really the end. Summarizing lactate, point of care lactate, it will reduce your time to results. It will improve your trash. It will be much faster, especially for time to intravenous fluid. It will reduce your rates of ICU admission, reduce mortality, and for fetal scalp lactate can help to identify and prevent neonatal hypoxia and acidosis. Okay, and that's it. Thank you very much.